So I'm Robert Martindale. I'm the Chief of General Surgery here at Oregon Health Sciences University. It's a large teaching hospital in the northwest part of the United States. In fact, we're the largest largest training program in the United States for surgery. We have been involved in immune modulating formulations and the use of immune modulations in the perioperative preparation of the patient now I've been doing it for about 30 years. We now have literally unlimited amount of human data to show its benefit, and we've shown this both in multiple trials and multiple protocols, as well as several others have also. I've been asked today to discuss the concept of immune modulation and when it should be used. I think the first place we have the most data for is the use of immune modulating diets in the perioperative period. Now, data has been around since about 1990, 1995, and we really in 2000 solidified this data with the concepts of Marco Braga and his work in 2002. He showed very nicely that using immune modulating diets are really given for the concept of enhancing the patient's immune system, enhancing the patient's ability to respond to a stimulus, and modulating the metabolic response to stress. So I think in that case, we can use these immune modulating formulas in the preoperative period and for large operations, esophagectomies, Whipples, gastrectomies, etc., and big operations where we expect a significant metabolic challenge. And we know that the fish oils in these modulating formulas decrease the metabolic response to stress. We know that the arginine in these formulas essentially do a lot to enhance immune system as well as wound healing through the arginine systems, and we'll talk more about that later. We know that the nucleic acids in these formulas increased. We used to think it was just through nucleic acids, giving a substrate for rapidly dividing tissues. We now know there's a whole purinergic nervous system which is involved, which may alter blood flow, wound healing, and all these concepts. So really, in the well-nourished patient, we can use them in the preoperative period to modulate the metabolic response. In the malnourished patients, most people would suggest using it preoperative and postoperatively in that setting. I think if we go on to who needs it, do cancer patients do best? Clearly, that's where the most data is. There is data in head and neck surgery, and head and neck cancer, even benign head and neck surgery. There's also data in cardiac surgery, but I would say 80% of the data is in visceral malignancies, gastric, esophageal, and pancreatic. And again, data is very solid. Probably the best meta-analysis is done by Mazzocchi in 2014 in the Annals of Surgery. He had 75 prospective randomized trials put into a meta-analysis, over 7,000 patients, and virtually decreased intra-abdominal abscesses, decreased infections, decreased anastomotic dehiscence, and now because of the power of a 7,000 patient study, he showed decreased mortality with the use of immune modulating formulas. So again, the outcome, we talked about using these as part of a protocol. Now, many people, in fact, most people, both in Europe guidelines as well as the American guidelines, would use these as part of a combination of things, as part of like, for example, the ERAS protocol or the Strong for Surgery protocol, or for now in Brazil, we have I think it's the EVERT group, which is basically many protocols on preoperative preparation, use of minimally invasive surgery, carbo loading, immune and metabolic modulating formulas, and sort of combining these in multiple steps, multiple protocols into one large protocol to enhance recovery, sort of optimizing patient recovery, which works very well. So this is really part of a larger protocol which optimizes all those outcome parameters. So now we just presented the data at the SBAD Congress in Brasilia, just on Sunday and Monday of this week. The data was very well received with a fairly large audience, again showing the actual data with numerous papers, and I think that's available online to most people now. If we look at where do these benefits, what do we see? I talked about the Mazzocchi paper, but really across the board, whether it's head and neck, chest, or belly surgery, visceral malignancy surgery, we show decreased infections, decreased length of stay, shortened ICU stay, better wound healing, and really across the board. And as I mentioned, the Mizuki trial, which has now shown decreased infection and decreased mortality because of the 7,000 patient study. So many people ask the question, why don't we just use regular protein? Just use the high protein formula versus immune modulating formula. I think that's a very good question. And I think we have data that, in fact, high-protein diets are helpful also. But when we compare a high-protein diet or any standard formula to the immune-modulating formulas, we still show clear benefit of the immune-modulating formulas over those. So then, in summary, what can we say? How do we get a patient prepared? Certainly, if you have time, exercise is key. Reducing our incidence of sarcopenia, trying to maintain muscle mass, high protein. 5 days before surgery, then we would use an immune modulating formula or a metabolic modulating formula. I personally like the term metabolic modulating better. That's 5 days before surgery, usually about 750 cc's. And then within 3 hours of surgery, we would do carbo loading, or the use of, again, using a formula, in fact, which the patient drinks 3 hours pre-op, which lowers insulin resistance and helps there. And in the post-op setting, you may or may not need these immune modulating formulas. If they're not doing well, if they're malnourished in the pre-op, then you can consider the use post-op also.